Hello there, grade 6. For today, we are going to talk about still under the musculoskeletal system, but regarding the diseases that affect the musculoskeletal system. Musculoskeletal refers to which two types of systems natin? Ang ano? Ang muscular and skeletal system put together. Okay? So bakit nga ba dinikit ang muscular and skeletal system? Kasi they basically work together. Okay? Of course, without including the nervous system, parang partner kasi ang ating muscles and bones. That's why. Okay? Common bone and muscle injuries. We have the fracture, sprain, torn cartilage, and the joint dislocation. Masakit, masakit. Lahat yan, syempre injuries eh. Everything is painful, pero parang para sa akin, I think, joint dislocation, torn cartilage, ang mas masakit, pinakamasakit. Ang least ata dito is ang sprain. Pero masakit yan at first, of course. Okay, anyway, meron pa tayong tendinitis. Okay, tendinitis. Fracture. Ano nga bang fracture? Yan ang fracture. Ibig sabihin, when your bones actually break. No? A fracture is a break in a bone caused by a fall or pressure in the bone. So ano nga bang pressure? Ang fall, syempre pag mahulog kayo from, let's say, a high ground. No? Nahulog kayo. So, there's a possibility na mali yung paghulog ninyo, applying pressure to that area, which leads to your bones breaking. And we don't want that to happen kasi masakit yan. Okay? That's why be careful kayo. Can be classified as simple or compound. Okay, ano nga bang difference ng simple and compound? A crack, so red ha, red to for simple, because simple is red. A crack or break that does not pierce the skin is called a simple fracture. Ano nga, what do you mean by pierce? Pierce ibig sabihin that doesn't go through your skin. Okay? As much as I want to show you pictures, pero I don't want you to see that. If you want to search for it, search na kayo sa Google. Ayoko include dito sa topic ko. For everyone's ano ba to? Anyway, for compound, if the bone breaks through the skin, ibig sabihin, it will pierce through your skin and causing an open wound, it is called a compound fracture. Okay, that's the difference between the two. So, ang simple, hindi lalabas sa skin ninyo. Yung the other one naman is compound is when the bone will basically tear your skin, pierce through your skin. Okay? A person with a fractured bone suffers severe pain, difficulty in movement. Of course, kasi broken na nga eh. So, di ba, nabali na. So, paano pa kayo mag-move ng maayos? Okay, swelling, bruising, or bleeding of the injured part. So, that's why kayo, mga boys, especially mga boys, yung mga mahilig magtakbo-takbo. Di yun? Be careful ha when you play. Especially when you tend to like push someone else as well. Kayo lahat. Okay? So be careful when you play in the near future. Okay? For now, pero medyo limited naman siguro yung playtime ninyo with your friends. Okay, so sprain. Tapos na tayo sa fracture. We now go to sprain. Occurs when a ligament in a joint is overstretched or torn. Yan ang pinaka common. Ang ankle breaker. Sa basketball pa yan, we call it the ankle breaker. I mean, the movement. It can technically damage the ligament sa joint ninyo, which will basically make us difficult to walk for a certain time. Okay? So, careful kayo kung naglalakad. Actually, this happens parang like kahit kayo, na-experience nyo na yan, kahit you're just simply walking lang, nangyayari yan sa atin. Especially for the girls in the near future, if you are new to wearing yung mga high heels na yan, mga shoes, nako, be careful lang po tayo. Anyway, going to the next, we have the torn cartilage. Okay? Torn cartilage. A common knee injury. And especially in sports. Kasi yan, syempre nga, mas mga sports, they keep on running. Especially yung mga basketball, football, soccer, mga ganyan. Okay? Ganyan talaga yan. So that's why extra careful lang. That's why yung mga players, they easily get injured. Okay? Torn cartilage is also called meniscus tear. Tear. Torn cartilage is also called meniscus tear. Okay. Cartilage, yan kasi yung nagpo-protect eh. Yan, no? Pag magte-tear yan, you will basically feel pain. Masakit yan. Over-twisting can lead to cartilage tearing. Okay, this causes severe pain and massive swelling in the knee. So, common talaga siya sa knee. No? Diyan talaga siya mostly nangyayari. So, the other one is joint dislocation. Dito na yung nagdi-dislocate yung joint natin. So, if you notice this, no, yung one of our joints sa shoulder, if magmi-mismove kayo, mabangga kayo, mahulog kayo, tapos yung shoulders nyo ang unang natamaan, nako, it will get dislocated. Okay? So, occurs when bones in a joint become displaced or misaligned. Ito yung normal. This one's the normal. These two are the different types of dislocation. Okay? Possible cause of sudden impact from falling or accident. Pag nabangga kayo, nahulog kayo, like yun na nga, and the impact is nasa shoulder ninyo. So, be careful lang nga talaga when you're playing on a high ground or nasa taas kayo somewhere. Kahit mga 6 to 10 feet lang. Delikado na masyado yan. Kahit ang 6 feet lang nga, nakakatakot na. Okay? The ligaments are damaged at this point resulting to dislocation. So, ligaments, the ones that connecting, no? So, obviously, pag na-dislocate, madadamage din po talaga yung ligaments natin. Okay? Okay, next is tendinitis. Ano nga bang tendinitis? So, tingnan natin itong part na to, yung ng tendon. A tendon is a tissue that connects a muscle to a bone. Ito yung muscle, ito yung bone, so ito yung tendons. Okay? Yan ang tendon natin. Tendinitis or tendonitis is the swelling of the tendon. It causes pain and inflammation. Okay? So, yan na yung part na yan. Nadadamage at some point, swells and gets damaged. And takes time for it to heal. Okay? We are not Wolverine. Si Wolverine kasi mabilis mag-heal. Sana all. Common bone and muscle disorders. So, kanina, we were talking about, balik lang tayo. We're talking about common bone and muscle injuries. Ngayon naman, we're going to talk about common bone and muscle disorders. Okay, ano nga ba yung mga disorders na yan? We have one, osteoporosis. Second is we have rickets. The other one is arthritis. Yan, osteoporosis and arthritis, very normal yan. Okay. Muscular dystrophy and the soft tissue sarcoma. Okay? So, discuss natin yan one by one. Osteoporosis. Normally, we say that, for example, yung mga matatanda na over age, yung mga senior citizen na, especially if they're in a stooping position like this one, nagiging kuba na. So, sometimes we say that, oh, that person has osteoporosis. Pero the real definition kasi ng osteoporosis is that osteoporosis means a person has a brittle bones. Ano nga bang brittle bones? Anyway, osteoporosis means porous bones. Common in old age and also those with calcium deficiency. Ano nga bang ibig sabihin ng calcium deficiency? Yung mga hindi nagkaroon ng sufficient calcium in their body during their growth. Okay? So, like what it says here, no, brittle, ibig sabihin, it's sensitive. It's easy to break. Yan ang nakakatakot sa part na yan. Okay? During this time, bones become weak and can easily break. That's a disadvantage if you have these porous bones nga. Okay? Sensitive na yan. This can be prevented if you consume food or drinks that is high in calcium, such as milk. Okay? Milk ang pinaka-common sa atin. Even your parents will tell you, oh, if you want to grow taller, if you want to have strong bones, drink milk. Diba? Yan ang sinasabi nila sa inyo. And these are examples of food na high in calcium. Okay, so yan yung mga food na meron tayo. Ang pinaka-common sa atin dito na nakikita natin sa atin is we have the oranges. Yung mga green vegetables, nakikita nyo lang din yan dito. Okay, common yan. Yung tofu, I don't know if you are eating tofu. Okay. Mga nuts, almonds, oh. Kaso nga lang almonds very expensive. Baked beans, yan din ang nagdadagdag ng calcium, nagpapa-strong pala. And also whole meal, yung bread. Okay. Broccoli. Kumakain ba kayo ng broccoli? Blackberries. Yung baked beans, actually kasi sa mga matatanda, sinasabi nila don't eat mga food yung mga ganyan, yung mga beans kasi it will add up to your joint pains. Pero yun pala high in calcium that basically makes your bones stronger. Okay? It's just that siguro nakaka-affect ito sa mga joints. Okay? That's the disadvantage there, especially if you're getting older na. Okay. Rickets. Okay, ano nga ba ang rickets? This is a sensitive disorder, no? A disorder that is caused by vitamin D and calcium deficiency. Okay, yun lang din. Lack sa milk. Pero yun, paminsan nagkakaroon nga talaga ng rickets yung tao. So, this is a condition that may lead to deformed legs. Bones are fragile and can break easily. So, ito yung mga food na high in vitamin D. Okay? So, kain-kain lang kayo para kasi it disappears daw as early as a certain age. So, anyway, yun na yung sa rickets. I did not add an actual picture of a person na may rickets kasi baka you might make fun of the person. And I don't want you to do that. Alam nyo na si Teacher Mark, I don't like that kind of attitude inside the classroom. Okay? So anyway, if you want to search up, just search up for rickets para makita nyo talaga yung actual. Okay, actually, ito pala. Idadagdag ko na lang to. So, especially, this is basically common for babies kasi eh. Okay? Yan ang common sa mga bata. Okay. Arthritis. Ano nga bang arthritis? Ito yung sinasabi ko kanina. Joint pains, no? So, arthritis is caused by the breakdown of cartilage at the end of the bones. Ano nga ba yung cartilage? Ito kasi ang cartilage, the white part. Yung sinasabi ko sa inyo, yung sa fried chicken. After eating the chicken leg, the drumstick, yung end part niya, yan may cartilage tayo, yung puti. Okay. Once kasi mawawala yan, it will get thinner. There's a possibility na yung friction na will now happen between the bones. So this one is like a protection. So pag wala yan, it's like a helmet. Pag wala yan, ang friction na will be between two bones and that will really cause pain, masakit. Okay? The pain is caused by the friction between two bones as the cartilage becomes thinner. So yun in-explain ko na kanina. And this may be felt in any joint. Okay, any joint daw yan. Okay. Most common in hips, knees, or fingers. Okay. Pero mostly talaga nangyayari to sa knees at saka sa fingers. Parang less ko naririnig yung sa hips, pero mas marami talaga knees and fingers. Okay, anyway. Muscular dystrophy. Ano nga ba ibig sabihin yan? A disorder where muscles become weak. So kanina meron tayo yung when bones become weak, yung osteoporosis. Ngayon naman, muscles naman ang nagiging weak. An inherited disorder which affects the skeletal muscles. There is no known cure for this. Okay, so nakakatakot if you have this. Pero wala naman siguro kasi active kayong lahat. This may appear rather, as early as 5 years of age. So, be extra careful lang tayo. Okay, next is the soft tissue sarcoma. Okay, a cancer of the soft tissues like muscles and tendons. As cancer spreads, it can press on nerves and organs near it. Kasi lalaki yan eh. So, what if it happens somewhere sa katawan sa loob ng malapit sa mga sa mga organs ninyo. So, it can damage your organs. Okay, so delikado. Can cause pain and breathing problem. People may develop this cancer due to exposure to certain chemicals or radiation or possibly a genetic disease. Okay. can be treated through surgery, radiation therapy, and chemotherapy, or basically the combination of three. All three para matanggal talaga yung cancer na yan from that certain part of sa muscles ninyo. Okay? Yun na nga, muscles and tendons. Okay? So that's basically it for this topic. We talked about the diseases and disorders of the musculatory system. Okay, yung sa musculoskeletal system rather. Okay? So for both muscles and bones yan. Muscles and bones. So that's basically it for today.